everyone. Thank you for joining us. So today we have a presentation by Dr. Torres. She'll be speaking about addiction treatment for Chilean adolescents on challenges in equity and access. And I'm welcoming for everyone to maybe introduce themselves and say their name and their role or like what your position is. So I can start. I'm Andrea, and I'm a research assistant with the Addictions and Concurrent Disorders Research Group. And Rocio, would you like to go next?
Yeah, I'm a Chilean psychiatrist, and I work at the outpatient program, and also I'm collaborating with the research group too.
And then maybe Lorena can go next if you're comfortable. Or Dr. Torres, would you like to introduce yourself too?
Yes. Hi, I'm Betzabé Torres from Chile. I'm a psychologist and I'm a researcher in adolescents' mental health and sexual health, and I'm a professor.
Amazing. And then would anyone else like to introduce themselves as well? Okay, so let's get started. Just a note, if we have any questions or comments, please try to comment in the WOVA chat. If anyone has any questions about how to do that, hopefully you're doing in the other sessions, let me know. Otherwise, you can also text in the chat, and then I'll try my best to make sure all the questions are answered. So, and then we can get started. Thank you, Dr. Torres.
Well, I'm going to start the presentation. As I was saying, my name is Rocio. I'm a Chilean psychiatrist, and with Dr. Torres, we'll be presenting addiction treatment for Chilean adolescents, challenges in equity and access. For this presentation, we have the collaboration of Maria Victoria Contreras, Acting Director of Senda Valparaíso. First, the background. Chile is a South American nation located between the Andes mountain range and the Pacific Ocean. Since the 1980s, there has been a sharp increase in illegal substance abuse in our country. It was during this decade that state organizations for substance abuse were set. The current National Service for the Prevention and Rehabilitation of Drug and Alcohol Use, SENDA, was created in 2011, and it depends on the Ministry of the Interior. So far, there are 148 centers for teenagers distributed through the 16 regions of our country. Some of these are public and some are private, and provides intensive outpatient treatment and residential care. In 2017, Senda used approximately $71 million for treatment and rehabilitation programs, and 28.3 million was for teenagers treatment. Finally, Chile's investment in drug treatment is lower than observed in the United States. The same occurs when analyzing the expenditure on drug demand control. Chile not only invests less as percentage of national income, but also has higher prevalence rates of substance abuse comparing to other countries such as the United Kingdom, Germany, Croatia, and Italy. Now let's take a look at how Senda is handling this tough situation. Senda has four main components: early detection with Senda Inicia, which means Senda begins, prevention with Senda Previene, treatment and rehabilitation, that is called Senda Opportunities. Senda has two additional key components: the observatory, which collects and analyzes data, and the early warning system, which identifies threats to public health related to new psychoactive substances and emerging drug phenomena. One notable health promotion program is the Continuum of Prevention, which assists in developing social skills through in-person and digital activities. Another program called Elige Vivir Sin Drogas, or Choose to Live Without Drugs, stand out for its prevention efforts and promotion of healthy lifestyles among primary and secondary school students. Additionally, Senda offers treatment programs for teenagers based on the severity of their consumption. The explicit health guarantee is for those with moderate risk, while the treatment program is for those with severe addiction. There is also a specific programs for teenagers who have broken the law and have severe addiction, which may include additional supervision and support. All of this is guided by several principles. Some of the most important are developmental approach that takes into consideration the user's stage of the development and the tasks they need to achieve. Interdisciplinary and biopsychosocial work that allows recognizing the complexity of the problem and the need for various perspectives and interventions. Finally, another fundamental principle aims to be community mental health. Now I will show you some numbers about prevalence of drug use among teenagers in Chile. Here we have interesting data on the prevalence of alcohol consumption among high school students in different countries and regions of America. As you can see on this graph, which was obtained from the 2022 Women and Drug Policy Report, Chile falls in the middle position compared to other countries when it comes to this substance. However, what stands out is that in Chile, teenagers women show a higher consumption rate than teenagers men. This is an important finding that underscores the need to understand and address gender-specific factors related to substance abuse among young people. Regarding tobacco, we can see that Chilean teenagers have the highest consumption of this substance compared to other countries studied. There is also a higher consumption among women than men. When observing what happened with marijuana, Chilean teenagers also have the highest consumption of this substance. Something similar occurs with cocaine, but in this case, consumption is much more prevalent in men than in women. In the case of ecstasy, Chile also has one of the highest rates among teenagers, only similar to Canada. In fact, ecstasy consumption in the general population increased by 324% between 2015 and 2020. On March 29th of this year, the most recent national study on drugs among the school population in Chile was published. These graphs present some of the key findings highlighting the trends in prevalence of marijuana, cocaine, and base-based consumption among Chile students from 2001 to 2021. This study showed a significant decrease in the consumption of substance by young people. Looking at the graph, we can see that marijuana consumption has dropped compared to 10 years ago, reaching to 18.8%. Cocaine use also decreased, going down to 1.9%, and base is now at 1.1%. It's not shown in the chart, but alcohol consumption has fallen too, reaching 24%, which is quite a bit lower than the 35% we observed in 2015. Experts attribute this, among other factors, such as the pandemic, confinement, and public policies. Despite this slight improvement, the latest annual treatment outcomes report shows that if only those people who enter treatment for the first time are considered, as shown in the graph, it can be observed that also the age of onset of consumption of the main substance is 12.6 years. The age at which they mostly enter treatment is almost 17 years old, which highlights the need to carry out more action that allows for timely screening, problematization, and referral. Now, Dr. Betzabé Torres will continue with the presentation.
Now that we have seen the current situation regarding consumption and treatment among Chilean adolescents, we want to talk about how health equity relates to access to treatment for this population in our country. Health equity means fair access to opportunities for optimal health and well-being, and it's composed of 3 dimensions. First, health equity includes seeking the highest standard of health service and opportunities for all people, regardless of their economic or cultural background. Second, health equity is dedicated to reducing inequities in the determinants of health. Third, special attention is given to those groups of people at higher risk of poor health. In Chile, there are key factors that influence health equity in adolescents. First, evidence indicates that when they live in socially and culturally deprived family and community contexts, there is a greater association with drug use. This is because of the presence of drugs in the community, fractured social networks, and the fact of being victims or witnesses of physical, psychological, or sexual abuse. In the case of migration, displacement to another country may be related to drug use due to the risk condition and anxiety that this situation implies. Finally, gender impacts on difference in the type of drugs that young boys and girls use, and on the fact that girls have higher risk related to drug use. Regarding to gender is a key determinant in the way adolescents experience drug use and in the treatment they receive. In some studies, girls have reported having sexual relations when they were unable to give active consent because of being under the influence of drugs, putting them at risk of sexual crimes. On the other hand, it has been observed that girls began the delinquent trajectory with drug trafficking, which is not the case with boys. Also, some studies have demonstrated that among the reasons for drug use in girls are low self-esteem, not meeting female aesthetic patterns, seeking social acceptance because their partner consumes, or as a form of subversion to the norm, especially with alcohol. In addition, for both boys and girls, drug use implies a greater risk for sexual health, especially because unprotected sex. Furthermore, traditional masculine identity, it's a risk factor for drug use in boys. And in some recent studies, it has been observed that in treatment, theoretical elements that include a gender approach exist, but there are difficulties in translating them into concrete action in treatment. In this way, Chilean adolescents who experience this inequity have their development affected, which influence their relationship with drug use, since poverty and violation of rights are associated with an increase in drug use. There are difficulties in accessing treatment. They have higher probability of not seeking help or not adhering to treatment. These difficulties in accessing treatment are exacerbated in the case of migrant adolescents. Drug use is a way of dealing with difficulties. Children and young people who are part of the child protection system have more mental health problems, including drug use, and more difficulties in receiving treatment. And there is a lack of treatment in the community context. Then, regarding health equity in drug treatment for adolescents, what has been done in Chilean public policy? First, an approach based on social determinants of health has been adopted. Second, it is recognized that graded coverage is required and that there is a need to incorporate a gender, intercultural, migration, and sexual diversity approach. Third, problematic drug use treatment for adolescents has been included in the public health system, and treatment is provided to adolescents in detention. Finally, based on this background, we can conclude the following challenge to promote health equity in treatment for adolescents. Although the direction in which Senda is moving is correct, there are issues with the resources allocated to treatment and implementation. First, there is a need for an adolescent-centered approach, which implies timely screening and problematization. Second, concerning increasing the use of synthetic drugs, it's necessary improving the dissemination of information on emerging substances and the different tools available through Senda. Third, it's important developing specific protocols to address needs for vulnerable groups, for example, migrants, women, and LGBTQ adolescents. And there is a need for reducing access gap, giving digital opportunities and effective community-based treatment. Addressing this challenge will help provide equitable access and quality treatment and service for adolescents addiction. Thanks.
Thank you so much, Dr. Torres and Rocio, for this really interesting speech about health equity and the public system background in Chile.